What I really appreciate about the dissection lab is that it's small groups with a lot of interactions. So it's really, really interesting. We learn a lot.
I found it really fascinating to be able to use the products, but then go ahead and do a dissection afterwards just to really sort of test and see, as well as have trained experts that are international that come to this program to share their experience and really kind of guide you and walk you through it. So it was a really useful program. So it was really kind of interesting for me in a couple of high risk areas, such as upper forehead, again, where we're concerned about the vasculature, and nose, to be able to sit there with colleagues with lots of experience and different background disciplines than mine, have them walk me through and actually be there with me while I do some cases and try some new techniques that I normally wouldn't venture into on my own. So I have a host of new experiences and a little more confidence now doing some of these areas that I hope to bring back to my own caseload back in Canada. And I absolutely highly recommend. I'm actually looking at some of the other course curricula that's available, and I'm thinking myself even of coming back. So yes, not only would I highly recommend it, I'm actually looking forward to my next opportunity to return.
The best part was the clinical anatomy part of it, which was a very hands-on approach to see exactly where our fillers are going, the hot spots, danger zones, and sharing injection techniques with our esteemed colleagues and prosectors and teachers, as well as our cosmetic doctors from around the world. It was amazing. The hands-on approach is both, it's very tactile, so we have the opportunity to have syringes with dyes, with cannula and needle, on the cadaveric examples, and watching our colleagues' different techniques as well. So approaches to get to, say, the deep layers, the superficial layers, and then also the live demonstrations, and then the patient volunteers, which are very, very amazing to have. So that tactile opportunity to try new techniques with the guidance of our expert teachers. That was really amazing. It has a wide range because depending on the group, we might have, say, a specific instruction for lips, but then within your own small group, if the question arises for, jawline or neck, or something specific about nose technique, it's up to that individual expert who has experts in all areas to then help with those specific questions. So if you're coming with burning questions, they will get answered.
This is a very big chance to be here and to meet many doctors from all over the world, and especially to learn and to see face to face with other doctors, very experienced doctors here on ECAMS. So this is my big opportunity because when I attend to some conference before, I just saw them far away to give a lecture. But now, like Nabila, I can, learn from her directly. So it's my pleasure to do that at ECAMS.
I think if any doctors want to improve their skills, even though they are very experienced or even they are beginners, this EM course is the best because you can really learn how to inject, how to avoid complications, and how to make your patient satisfied. And therefore, you learn a lot. You learn a lot and you earn a lot.
When it comes to ECAMS, this is the first time to ECAMS, but it's so impressive. It's have very, very intensive course for everyone. Even in Thailand, the class to learning about some area, in danger area, we not teach that. But here, you can learn it. Very good.
So mentors really, really took a very personal care into the finer details of the way we are kind of, holding a thing, the way we are approaching to an area, and the way everything had been structured, and ample time that we were all given to treat the patient in a holistic manner. That was something very, very, very nice and very unique about it. If you really want to kind of enhance your treatment skills and your knowledge a notch higher, and as per the latest innovations and as per the global standards, the latest global standards, ECAMS is the place to be. I really feel they're doing their best in its own way to make aesthetic knowledge and aesthetic education so professional, so structured, and so globally in sync with the latest innovations that I really feel this is the go-to place, and I wish it kind of grows by leaps and bounds and be the destination for every student globally to kind of look forward to and get certified and feel more confident and all the more fall in love with the profession and with your own passion coming here.
I think ECAMS is a whole experience in aesthetic field, so we offer hands-on training. Each delegate chooses the area of interest, and we are sharing experiences, we are sharing the new techniques, new modalities of treatment, according to scientific background and the new publications. Also, we have the wet lab or the cadaver lab, so we can try every technique safely on cadavers. Also, we have a theoretical part, so each one of the faculty and from my colleagues discuss a topic of interest, and we discuss the new modalities and techniques, and we are sharing experience. For myself, as a faculty member of ECAMS, I usually, each time I come to the course, I benefit more, like the delegates, because we are sharing experiences, we are exchanging knowledge and exchanging tips and tricks. So where is a chance to try it? First on my patients in the clinic, or I can attend a course like here and just inject it on models under supervision of one of the faculties and see what's safe, what's unsafe, how can we do it, how we use cannulas, how we use needles, where, which layer, which product. So I think online courses are important, but attending physically are much more important.